Hi, my name is Emmanuel Cruz Carrasco. I'm going to read chapters 14 and 15 of the textbook Professional English Used in Medicine. I'm going to begin reading. Chapter 14 Symptoms and Signs. A. Describing problems. The problems which a patient reports to the doctor are called symptoms. For example, pain or nausea. Signs are what the doctor finds, also known as findings, on examining the patient. For example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaints. To report a patient's symptoms or complaints, doctors say Mr. Farnsworth was admitted complaining of chest pain. In case notes, the abbreviation CO is used. CO, chest pain. B. Presentation. Patients say they went to see the doctor. Doctors say the patient presented. The symptoms which causes a patient to visit a doctor or to present is called the presenting symptoms, presenting complaint, or presentation. His presenting symptom, presenting complaint, was chest pain. He presented to his GP or general practitioner with chest pain. The usual presentation is chest pain. C. Talking about symptoms. Symptom: tiredness, lethargy, fatigue, lassitude. Meaning: loss of energy. Patients say, I feel tired all the time. I feel completely worn out. Lately, I have been feeling completely exhausted at the end of the day. Symptom: malaise. Meaning: general feeling of being unwell. Patients say, I feel unwell. I don't feel well. I have been feeling off color for 2 days. I have I haven't been feeling myself for a week. I have been out of sorts all day. Symptom: anorexia, meaning loss of appetite. Patients say, my appetite is very poor. I have been off my food for days. Symptom: weight gain, meaning increase in weight. Patients say, I have put on 8 kilos in the last year. I have gained 5 kilos. Symptom: weight loss, meaning decrease in weight. Patients say, I'm not eating any less than usual, but I have lost a lot of weight recently. Symptom: constipation, meaning hard, infrequent fishes. Patients say, my motions are very hard. I have been quite constipated lately. I'm not very regular. Note, the verb feel is also used with other adjectives such as hot, cold, nervous, anxious, dizzy, weak. She said she felt dizzy. Now I'm going to read the exercises of chapter 14. 14.1. Complete the table with words from C opposite. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Noun: exhaustion. Adjective: exhausted. Noun: fatigue. Adjective: fatigue. Noun: lethargy. Adjective: lethargic. Noun: tiredness. Adjective: tired. 14.2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. The words in the boxes are, in the first one, complain, of, out of, present, put, won. In the second box are worn, with, of, out, on, color, source. The combined words are worn out, put on, out of source, present with, of color, complain of. 14.3. Complete the sentences with the correct form of the verb present. 1. A 67-year-old a 67-year-old man presents with a 9-month history of increasing shortness of breath. The most common presenting symptom is loss 2. The most common presenting symptom is loss of consciousness. 3. Cranial arteritis may present as fever without any obvious causes. 4. The patient usually presents with a severe sore throat. 5. The presenting symptoms in this patient could perhaps be due to renal failure. 6. Other conditions with a similar presence include acute cholecystitis or cholecystitis. 7. Reduced growth is an important present complaint of celiac disease. 8. Celiac disease. 8. 2 months following presentation, the patient was able to walk. 14.4. Read the patient's description of her symptoms, then complete the case report. Look at C opposite to help you. I was well until a few months ago. In the beginning, I just felt off color and a bit tired, but lately I have been feeling completely worn out at the end of the day. I'm not eating any more than usual, where I have put on 9 kilos in the last year. My motions are hard and my hair has started to fall out. Case 13. A 50-year-old housewife who had been well until 4 months previously, feeling of tiredness and of color. She had gained 9 kilos in weight in the year before. She presented to her GP, although she denied eating more than usual. She was constipated, and she noticed that her hair had started to fall out. Now I'm going to read Chapter 15, Blood. Chapter 15, Blood. A. Full blood count. In the investigation of blood diseases, the simplest test is a full blood count, of FBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocyte sedimentation rate, ESR, a measurement of how quickly red blood cells fall to the bottom of a sample of blood. B. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive destruction of red cells, low production, for example, because the dye is lacking or deficient in iron, which chemical symbol is Fe. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. Professor, what's the most likely diagnosis in this case? Student, most probably carcinoma of the bowel with chronic blood loss. Professor, what's against that as a diagnosis? Student, well, he hasn't had any change in his bowel habit or lost weight. Professor, what else would you include in the differential diagnosis of severe anemia in a man of this age? Student, he might have leukemia of some sort or aplastic anemia, but that's rare. It will be very unusual. Another cause is iron deficiency, but he seems to have an inadequate diet. Professor, okay. Now there's another cause of anemia which I think is more likely. Student, chronic bleeding ulcer? Professor, yes, that's right. But what about pernicious anemia? Can you exclude that? Student, he's got none of the typical neurological symptoms like paresthesia. Paresthesia. See pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language notes in his notebook, in his textbook. Pernicious anemia (PA) is a condition in which there is atrophy of the gastric mucus with consequent failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidious and progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and mild jaundice, caused by excessive breakdown of hemoglobin because of ineffective red cell production in the bone marrow. A red sore tongue, glossitis, is sometimes present. Patients present with symmetrical paresthesia in the fingers and toes, early loss of vibration sense, and progressive weakness and ataxia. The spleen may be palpable. Here are the notes on the textbook that Jordi Pons wrote. Onset beginning, insidious, slowly developing, pallor, lack of color, mild, slight, jaundice, bilirubinemia, breakdown, division into smaller parts, bone marrow, soft tissue in the cavity of bones, symmetrical, each side the same, vibration sense, ability to feel vibrations, progressive, continuing to develop, palpable, can be felt with the hand. Now I'm going to read the exercises of chapter 15. 15.1 Find words in the box with opposite meanings. Look at A and C opposite to help you. Adequate. The opposite of adequate is inadequate. Against. The opposite of against is for. Unlikely. The opposite of unlikely is likely. Severe. The opposite of severe is mild. Rare. The opposite of rare is common. Sudden. The opposite of sudden is insidious. So that was exercise 15.1. Those were the words and their opposites in the box. 15.2 Make word combinations using a word from each box. Look at B and C opposite to help you. The words in the boxes are: in the first box, bone, differential, insidious, iron, pernicious, progressively, vibration. In the second box are diagnosis, sense, onset, marrow, increasing, deficiency, anemia. Now the word combinations are bone marrow, differential diagnosis, iron deficiency, progressively increasing, pernicious anemia, vibration sense, insidious onset. That was exercise 15.2. 15.3 Complete the sentences. Look at A, B, and C opposite to help you. 1. A 39-year-old man presented with a history of progressive abdominal distension over a period of 6 months. 2. Blindness may be caused by a vitamin A deficiency. 3. The bleeding or purpura are caused by abnormal spleen function. 4. The white cell count is normal, so you can exclude acute leukemia. 5. The yellow color of her skin and conjunctivae is probably due to jaundice. 6. There was a palpable mass in the right upper quadrant of the abdomen. 7. Treatment is aimed at restoring fluid balance with intravenous fluids. 8. The anemia may be due to increase red cell count. Okay, so that was exercise 15.3. Exercise 15.4. Complete the conversation. Look at C opposite to help you. Professor, what is against the diagnosis of pernicious anemia on physical examination? Student, the problem started quite suddenly, so it didn't have the typical progression. He doesn't have any skin pallor, and he doesn't have symptoms of paresthesia or absent vibration sense, and he couldn't feel his spleen. Professor, what about his tongue? Student, his tongue was normal and not inflamed or sore. So that was chapters 14 and 15 of Professional English Use in Medicine. Chapter 14 was Symptoms and Signs, and chapter 15 was Blood. So that was the reading of the theory and exercises of these two chapters. Thank you very much for watching this video. My name is Emanuel Cruz Carrasco. So that was the video.